Obesity is one of the diseases that is most preventable in the United States. It has grown at such a staggering rate amongst adults and children that it is now considered an epidemic within the healthcare system. Obesity as an epidemic has caused a high rate of mortality, morbidity, disability, and utilization of the healthcare system due to the many ailments that are contributed by being excessively overweight. When we consider what obesity is, it is someone who carries excessive weight in the form of fat or excess adipose tissue on their bodies due to the amount of caloric intake through food. When someone has excessive fat tissue on their body, they have a heightened body mass index. This index is what measures the level of fat that is dangerous to the body. Having this form of excessive fat leads to different types of illnesses and diseases amongst a person who is obese. The amount of diseases that are caused by obesity are chronic health conditions that can vary in severity. Of the few that are most common and most chronic amongst obese people within the United States is that of type 2 diabetes, high cholesterol, hypertension, and heart disease. Of these diseases, those mostly impacted by are adults. Yet there has been a great concern in the amount of children who are now experiencing diseases due to obesity. According to the Center of Disease Control, obesity has become a health problem that has reached epidemic proportions in the United States. 32% of Americans are obese, while 66% are overweight, which leads them to becoming obese. Amongst children, 16% of American children are overweight, with the number tripling within the past 20 years. With the staggering rate of population of obese Americans within the United States, it has become a great concern amongst many people within the healthcare system as to what leads to a high rate of obese people within the American population. In healthcare, specialists being able to determine that excessive weight comes from a high caloric intake of food, they're also analyzing what types of foods are being consumed, why aren't all food-consuming Americans obese, and what factors attribute to certain food choices that inhibit excessive weight gain. In many different studies, it has been determined that one of the factors most prevalent to the epidemic of obesity is that of one's socioeconomic status. Socioeconomic status, by definition, is a person or family's economic status, education level, and their occupation. This status is very important to consider when comparing why some Americans are obese and others are not, as these factors all attribute to one's health, whether poor or good. In analyzing that socioeconomic status is a contributing factor to the epidemic of obesity, it has become of importance to come up with solutions in where those who are of a lower socioeconomic status have the ability to live a healthy lifestyle through healthy food choices. In a study conducted by Kopoulas and Nyes, they examined the relationship between the food stamp program utilized by low-income families who are of a low socioeconomic status, the food choices made while on the food stamp program, and the overweight status of those on the program. Within the study, the researchers wanted to demonstrate that based on the food stamp program, different food choices would be made based on the allotted amount given. They had the preconception that food choices would differ based on what was affordable. They also preconceived that when deciding what food choices to buy, the amount they were able to spend would influence healthier choices if they were able to afford it. The hypothesis created during this study was based on single mothers who were of a low socioeconomic status who were on food stamps trying to buy healthy food options and not being able to due to the amount of income provided by the food stamp program. The method used within the study was that of an analysis of items being purchased by these women on the food stamp program. In analyzing the food items, one could compare the need for buying certain food items and how much the participant was willing to spend based on the allotted amount of money from the food stamp program. Measured was calories per dollar, total fat, servings per food item, and total calories per food. The findings from this study determined that the shopper who was shopping for healthier food items was limited in her spending as she could only afford a certain amount of food items. The other shopper who was to buy more in quantity bought more food items that were deemed unhealthy and which consisted of processed foods and which are a contributing factor to obesity and other diseases attributed to high calorie, high sodium, and high fat content. Within this study, it was also determined that when one is impoverished and is on the food stamp program, one would utilize their spending amount to buy the most food possible without considering the health benefits. This being done in order to prevent hunger. It was also found that when someone chooses to buy healthier food options, the food stamp program does not allow enough funds to buy healthier foods in large quantities. What this study demonstrated was that for people on the food stamp program, the reality is that they are not able to live a healthy lifestyle within a certain budget for food. They must spend less but buy more in order to have enough food to get them to the next food stamp pay period. While buying healthier food options with food stamps provided quality of food but was not measurable in quantity, in which would not last long enough when considering the amount purchased. In another study by Kimbrough and Rigby, the focus on whether there is a relationship between food assistance programs and body mass index amongst its recipients consisted of young, low-income children whom are from areas that are more prevalent to federal assistance programs in industrialized areas. These federal system programs consisted of food programs which provide food such as the Women, Infants, and Children's Program, known as WIC, Supplemental Nutrition Assistance Program, known as SNAP, Child and Adult Care Food Program, and the National School Lunch and Breakfast Program. Of these programs that differ in the standard of nutritional services offered based on who is providing the food, it was hypothesized that programs that offer food and nutritional education, such as that of women, infant, and children, the Children and Adult Food Care Program, and the National School Breakfast and Lunch Program, there would be a government control of what children consumed, which would be of more healthy food options. In considering the SNAP program, where one can choose what food to purchase based on allotted amount, it was hypothesized that those who utilize this type of program would choose what they purchase based on their allotted amount without considering health options. The method utilized within the study was that of survey interviews that was gathered from the mothers of the children in order to determine demographic characteristics. Interviews consisted of questions to determine what federal system programs a child in or family was on, such as WIC, SNAP, and the Child and Adult Care Food Program, as well as the School Breakfast and Lunch Nutrition Program. Also considered within the measure was the cost of living within the areas that the mothers and children resided in. This was utilized to determine the different variation of food prices within their areas. Demographics such as race, parenting capacities, dynamic characteristics such as child's age, school enrollment, and the family structure were also questioned, as well as the employment status, educational attainment, household income, and whether they resided in public housing. The findings determined that participation in federal system programs that provide food does have a determining factor in the BMI of children. It was found that the programs that offered food and nutritional education, such as with the Women, Infant, Children Program, the Child and Adult Care Food Program, and the School Breakfast and Lunch Nutrition Programs, provided healthier food choices, as well as knowledge of a healthy lifestyle through eating. SNAP program, on the other hand, demonstrated that when one purchased food themselves, a participant bought unhealthy food in larger amounts, had children with higher BMIs. To conclude the study by Kimbrough and Rigby, it was determined that food stamp programs need to improve how assistance is provided when considering how to teach recipients of federal programs to make better food choices when they are given assistance, while also educating recipients on illnesses and diseases that one may succumb to from making unhealthy food choices. In another study conducted by Tate, Dillaway, Yarandi, Jones, and Wilson, gender, socioeconomic status, and residential status were examined in order to determine if there is a relation with obesity in African Americans. The factors considered were utilized to determine if this is an underlying cause of the obesity epidemic within this particular race of Americans, as the rate of obesity affects more African Americans than other minority groups. It was important during the study to analyze and focus on African Americans, as other studies have been able to indicate that African Americans are one of the classes that experience a lower socioeconomic status, live impoverished, live in urbanized communities, and have most of the prevalent diseases contributed by obesity. In order to take into consideration the different factors of obesity, assessments were given to adolescent African Americans from urban communities. This was to demonstrate that there's a correlation with socioeconomic status and obesity. To provide a quality analysis of the study, the researchers came up with three hypotheses. The first being that African American females will weigh more, have a higher BMI, and demonstrate a larger waist circumference. Second, obesity differences were demonstrated based on socioeconomic status. And third, that adolescents who reside in urban areas will demonstrate higher rates of obesity than those who live in the suburbs. The assessments involved measures of demographics that included age, gender, zip code, self-reported race and ethnicity, and the qualifications for free or reduced school lunches. Eating behavior based on the Eating Behaviors Pattern Questionnaire, as well as physical activity questionnaires, were administered. The findings within the study demonstrated that female adolescents were less physically active. demonstrated higher rates of obesity contributed by lower socioeconomic status, were also less active due to the urban areas not having an ability to gain access to safe local parks, also that not having a form of transportation inhibited their ability to go outside of their urban communities for access of healthier foods. In comparing with those who live in the suburbs, they demonstrated a higher socioeconomic status, access to safe parks, community centers, gyms, and most importantly, had the means to reach these destinations through their own transportation. Demonstrated in the study was a difference in African American adolescents based on their socioeconomic status, with those who live in suburban areas of higher socioeconomic status due to the environment and location in which all attributes to their disparities, and where those who have a lower socioeconomic status may not have the ability to improve on their health, which contributes to obesity and the many chronic ailments correlated with excessive weight. In the study conducted by Franklin, Wallander, Elliott, Torlotero, Corcoran, and Schuster, they examined whether there would be an association between socioeconomic status and the risk of obesity when considering children in early stages of adolescence. The hypotheses created by the researchers were: 1, if there would be an association of socioeconomic status with obesity risk amongst those of different race and ethnicities; 2, would there be an association of socioeconomic status and obesity amongst white children and adolescents, but not compared with other minority groups; and 3, if socioeconomic status would demonstrate a differential relationship amongst socioeconomic status with obese African American and white girls. The methods used for this study were that of gathering data through interviews from the parents and of the children within the study. The interview questions consisted of demographics such as race and ethnicity and socioeconomic status. Also asked was height and weight and BMI calculations of the children. In analyzing the data from the questionnaires, it was determined that within the study there was a definite relationship among socioeconomic status and obesity amongst both African American and white girls. This demonstrating that regardless of one's ethnicities, a correlation can be made when correlating socioeconomic status and obesity. Although the main focus was primarily focused on young adolescent girls, there was also a difference when comparing other race and ethnicities with those of Hispanics and whites, with Hispanics demonstrating a higher percent of obesity than white adolescents. Also found was that gender, when considering gender, young girls were more prevalent to obesity than adolescent boys. From the studies, it was concluded that although minorities are more prevalent to socioeconomic status and high rates of obesity, socioeconomic status is an important factor to consider when considering that obesity epidemic amongst all Americans, as obesity is not an issue of race or ethnicity, but rather an issue of what socioeconomic status can provide when considering how one is capable of living a healthy lifestyle when their status is detrimental to the type of lifestyle they may have. A study focusing on obesity, diets, and social inequalities conducted by Drewanowski found that there is a link within the high rate in obesity with food consumption by those within lower socioeconomic status. Due to being part of lower socioeconomic status, many minorities who are poor face a disadvantage when their diets consist of refined grains, sugars, added fats to snacks, and high sugar beverages based on what their income allows for them to purchase. It has been found in other studies that people of low-income neighborhoods have more fast food restaurants and small convenience stores in which does not provide healthy food options to the residents within the neighborhood. The difference in what one can find in urban areas compared to suburban areas where people have a higher socioeconomic status is drastic when in higher income areas people have access to full-size grocery stores where healthy food options are of abundance, as well as higher quality restaurants that serves many healthy food options for consumers. It has been found that when people do not have access to healthy food options, they are unhealthier, have more diseases, and are part of the majority of obese Americans within the United States. With the findings such as these, one can no longer put the blame of genetics, physiology, race, ethnicity, personal responsibility, and choice, but rather focus on the problem being stemmed from social class. Drewanowski makes a point within his findings stating that the unspoken assumption has been that healthful foods are inexpensive and that all Americans, regardless of household income, has access to a healthy diet, in which he states is not true. What Americans need to realize is that obesity stems from an economic issue. Evidence pointing to the rapid rise in food prices has been able to demonstrate that healthy food options are no longer an option. When there isn't an option, one will find other ways to survive, in which in the case of food consumption, those of a lower socioeconomic status is purchasing what can be afforded. Because food technology has been able to advance when considering agricultural, making energy-dense food accessible to all consumers and is expensive to make it, is then turned to food that is affordable to consumers as well. This providing unhealthy food choices for those who can only afford it, this making it an easy choice to make when considering that fresh fruits and vegetables are 10 times more expensive than food that is made through technology. With the dietary guidelines suggesting that replacing fats and sweets with fruits and vegetables and lower fat proteins leading to a healthy lifestyle, this must be considered that is not always feasible when considering that these healthier food options do not apply to lower socioeconomic status individuals when it cannot be afforded. With these findings, it must be considered that obesity has become an epidemic, and a focus must be made on the economic constraints of those who are obese. It must be pointed out that not all consumers of food have the same options due to their social class, and that there is a sound economic reason why there is a link between poverty and obesity. In conducting my research on the epidemic of obesity, I chose to use a methodology approach of a qualitative study that involved a structured sociological interview. This method best suited my research as it allowed me to interview a person of interest pertaining to the topic of socioeconomic status and the inability to afford healthy food options. Within the interview, I asked questions that could be answered thoughtfully by my interviewee, which allowed for an open-ended conversation where I was able to gain more information. With this type of method of interview that I conducted, I was able to have control over what questions I felt would contribute to my research on the epidemic of obesity. The questions I asked during my interview provided many important aspects such as emotions, beliefs, and honesty, and where my interviewer was capable of feeling that she was able to express herself thoughtfully. Within this interview, I was able to choose how this person from my interview allowed her shared experience with being of a lower socioeconomic status, a recipient of the Women, Infant, and Children Food Program, known as WIC, and Supplemental Nutrition Assistance Program, known as SNAP, which are both government-funded food programs that allow for purchasing of food through federal funds. Being someone who is part of these two forms of food programs allowed me to have insight on how food was being afforded, as well as being able to have access to a private matter such as this gave me a better understanding as to what in reality some Americans are faced with when considering how they will afford food and if healthy choices is of importance. In addressing the program of the Women, Infant, and Children, known as WIC, I was able to get insight on how the program worked. From my understanding, WIC provides women who have children under age 5 or expectant mothers food vouchers that can only be utilized for foods deemed as healthy through the Food and Nutrition Services governed by the United States Department of Agriculture. In order to be a part of this program, the mother of the child must attend classes on health and nutrition quarterly, which is implemented to educate women on healthy food. This I felt was important as it enforces that women become educated on providing a healthy start to their child's life. The Supplemental Nutrition Assistance Program, known as SNAP, allows for families to use a EBT card system that allows for purchasing of food for low-income families. The types of foods are not governed, and so being enforced to purchase healthy food is not necessary. One can use the amount allotted as one sees fit for their family. My interviewee expressed to me that using this program was easier than WIC because she can buy what she wants and what her family will eat. She mentioned she could stretch $1 if she needed to on this type of program. She also stated that choosing inexpensive food options were easier because both her and her husband worked, and so being able to create a meal without needing to cook was a lot easier, and it would assure everyone ate something. In having a better understanding how the types of foods her family ate, which were mostly processed, I asked her if anyone in her family had health issues. She explained to me that the pediatrician her children see told her her son, who is 11 years old, was considered overweight leaning into obesity, and that she needed to consider changing the types of meals at home for everyone so that her son could get back on the healthy side. She expressed to me that if she could make ends meet, she would not need public assistance, and if she could afford it, she would make sure her family ate better, but that she could only afford so much on the SNAP program before needing to spend her own money on food items. In hearing how she could only afford certain things on these two food programs, I realized that although the government does provide assistance to low-income families, they do not provide enough in educating the recipients on how to live a healthier lifestyle. Although the WIC program does enforce educational classes on health and nutrition, they still do not provide enough in funds to get a family through the month without them needing to find the means of extending their food supply. Also, with the SNAP program, there is not any form of education that teaches families how to budget their benefits or how to shop wisely when considering healthy food options. In gaining a better understanding of the food programs in which my interviewer was receiving, I took on the preconception that the importance was not on what was being taught regarding health, such as with WIC, but rather what can be afforded while on these programs. I could see from my interview that being on these programs is not something that is rewarding other than that a family is being fed, but rather it is stressful knowing that although one may not be able to afford enough food with assistance, one may also need to utilize their own money in which they may not have in order to purchase healthy foods. And in being able to purchase food, one does not consider what is considered healthy, rather what is able to be afforded. And so to shop with a healthy conscience is not something people of low income status consider based on their circumstances of needing to feed their families. Within my research, I found that the epidemic of obesity stems from one social class in which a person of lower socioeconomic status is more prevalent to being unhealthier and being obese due to what is considered affordable when purchasing food. More often than not, those who are of the lower socioeconomic status do not consider the quality of food that will keep them healthy, but rather on the quantity of food that will keep them sustained for a longer period of time when considering feeling hungry. Because many lower class people are families, the amount of food they are able to provide for everyone is an important factor. When considering what is affordable and what is within their means, one will settle for what is inexpensive and easiest to access. Many Americans who are deemed obese live in industrialized urban areas where food can be found in convenience stores and are of walking distance. And so to say that people have a choice to eat healthy or not is not necessarily true when there isn't any options, but to settle for what is easiest. The preconception that everyone has access to a healthy lifestyle is inaccurate when considering that not everyone has the same income. Not everyone comes from the same background, and not everyone lives in the same communities. And they are neither of the same social class. When the realization that these are our attributing factor to not only obesity but other health issues affecting those less fortunate, then many diseases and illnesses will continue to turn into epidemics and which can be prevented through methods that are utilized for those of a higher socioeconomic status, such as them having access to healthy food, access to education, and access to medical professionals who take into consideration the social class of a patient and how to better treat them so that they are healthier and less prevalent of acquiring chronic diseases and illnesses attributed to obesity. With the rising problems of health issues and health epidemics within the United States, it is of importance when considering that the overall health of Americans is on a decline. When we consider that there are so many health issues, there needs to be a focus on what health issues can be prevented when not considering genetics, physiology, and race, ethnicity. With the studies focusing on the rise of health issues, there have been many findings in that certain diseases and illnesses are attributed to health issues that are prevented. As with the disease of obesity and the health issues associated with obesity, it is a disturbing fact that it has become an epidemic, being that it is affecting many populations within the country of a lower socioeconomic status. When considering this population, many are of a lower social class, live in industrialized urbanized communities, are minorities, and do not have access to health care. Studies have indicated that those who are obese also suffer from secondary ailments associated with being obese. Many of these individuals also suffer from type 2 diabetes, high blood pressure, breathing problems, as well as skeletal issues attributed to the amount of weight on their body. Most disturbing within the findings of studies conducted is that obese children are now on the rise within the United States. With studies being able to demonstrate a correlation between obesity and socioeconomic status, policies must be made by the United States Department of Agriculture and Food and Nutrition Services in order to address that a disease such as obesity that is preventable must be met with concern in order to change health policies around the country. The Center of Disease Control must become actively involved in focusing on the study of preventable diseases such as obesity to better inform those within the healthcare system so that they can better treat and help prevent those of a lower socioeconomic status. The United States, being one of the most wealthiest countries in the world, should become active in the concern for health for all Americans, not just those who can afford to live a healthy lifestyle. Measures should be made in where equality for health is accessible to all Americans, regardless of income, race, ethnicity, backgrounds, in order to ensure that all Americans are healthy and are not a detrimental factor to our health system.